On this episode of Veterans HealthWatch, we're sharing tips for how to stay healthy throughout the winter season, so please join us. Welcome to Veterans HealthWatch, a program sponsored by the Veterans Affairs Maryland healthcare system that provides the latest health and benefits information for Maryland's veterans, their family members, and the local community. I'm Kenya Griffin. Whether you like cold, snowy days or you like to hibernate during the winter, no one wants to be sick, and germs are everywhere this time of year. But knowing what to do to protect yourself can mean the difference between a minor inconvenience and a major problem. So here to tell us more is Dr. Drew Gadea, the Deputy Chief of Staff for Ambulatory Care at the VA Maryland Healthcare System. Dr. Gadea, thank you so much for joining us.
Well, thank you for having me, Kenya.
Well, let's start with the flu. It's that time of year, and some people don't realize that the flu can be pretty deadly. So who should get the flu shot?
Well, in a nutshell, everyone over the age of 6 months should get the flu shot. But we have to prioritize those folks that are at higher risk. So these are folks that are older than 65, folks that are younger than 65 but may have chronic health care conditions like asthma, diabetes, kidney disease, heart disease, or other ailments, are women that are pregnant, and anyone that's involved in the care of youngsters or seniors.
Yeah, that's really important. Even if you're involved in the care, you want to protect them too.
Absolutely.
And how dangerous is the flu?
Well, the flu, I think everyone here knows that it can be quite hurtful. We've had a few thousand people die last year of the influenza, and there's a whole bunch of folks that suffer from lost time at work, lost time with their families, and also complications from the flu.
So it's definitely worth getting the shot.
Yes, indeed.
Then what is the best time to get the flu shot? I know there's a flu season, so is there a better time during that season than another to get the flu shot?
Well, Kenya, now is the right time if you haven't received your flu shot to go ahead and get it. We think of the flu season running often between October through March, and it does peak in January.
Okay, but get it now.
Absolutely.
If you haven't gotten it. And what about our veterans who are enrolled in the healthcare system? How can they get a flu shot?
Well, come on in. We are able to provide veterans flu shots at any of our sites of care. And for those that can't make it into our clinics, they are welcome to visit Walgreens, where I know the VA has engaged in a partnership to help veterans receive their flu shots at no cost to them.
Great. And again, the flu shots at the VA are also free.
Yes,
correct?
indeed.
For those veterans enrolled in the system?
Yes.
Great. And no appointments necessary? Walk in?
Walk in.
Good. And there are some symptoms associated with the flu that could be mistaken for other illnesses. So how can you tell the difference between your typical cold and the flu?
Very good. The flu oftentimes will present with similar symptoms to the common cold, but what makes it different is that it'll often present with a sudden onset, as opposed to a gradual onset of stuffiness and sneezing and coughing. This would be a pretty rapid onset of symptoms, and along with that you might have some body aches, headaches, feeling lousy, and just feeling worn out.
And so if you didn't get your flu shot and you get the flu, what should a person do?
Well, the most important things are to rest, drink enough fluids, and feel free to contact our nurse advice line if folks have questions about their symptoms. We'd manage it similar to other viral illnesses because most folks that develop the flu are going to have a spontaneous recovery. But some folks can develop complications, and therefore if you have any questions or if you feel that you're not getting better or don't know what's going on, feel free to call our nurse advice line, which is available 24 hours a day, 7 days a week.
And you mentioned that the flu is a virus.
Yes.
So we want to talk about antibiotics. And I know antibiotics are great, but they're not used to treat everything like a virus.
Yes,
so
indeed.
can you tell us, and sometimes they can be actually bad if they're not used properly. How so? Can you tell us a little more about antibiotics and how they work?
Antibiotics are lifesavers, and they've revolutionized modern medicine. However, they don't work on viruses, and the influenza virus is one of those that we don't have effective antibiotics for. Antibiotics can be used to treat complications of the flu, but it's important not to use them inappropriately because antibiotics, although they can kill the bad germs, they can also kill the good germs. And what we've learned is that when we kill off the good bacteria, we actually make ourselves more susceptible to harm.
So Dr. Gadea, this time of year we're in close quarters, air isn't flowing the way it normally does, so germs are everywhere, and somebody will get a little something that you can treat sometimes with over-the-counter medication. So when does one know it's time to call the doctor? The over-the-counter medication isn't helping.
That's a good question, Kenya. If we develop symptoms of shortness of breath or worsening in our illness despite initially feeling better, if we develop symptoms of severe vomiting, diarrhea, or confusion, then these are danger symptoms that we should not take lightly and we should contact our primary care team. Okay. If we can't reach our team, if it's after hours or on weekends or holidays, we have a 24-hour-a-day, 7-day-a-week telephone care line, which we encourage our patients to also utilize.
Okay, great. And then before we take a break, I know there's some simple steps that we can all take to help prevent some of these illnesses. Tell us about that.
Well, it won't come as any surprise to our viewers watching at home, but hand washing is the key. We encourage all of us that are watching to wash our hands carefully with soap and water for at least 20 seconds. If you don't have access to soap and water, utilize one of these new hand sanitizers that are on the market that are alcohol-based. But it's important to practice good hand hygiene to prevent infections.
So just a few things that we can remember to kind of sum up the whole conversation. If you walk away with anything, wash your hands.
Get your flu shot.
Get your flu shot. And
feel free to call us. We're here to help you.
Great. Well, thank you so much. And please stick around. We're going to talk to you a little bit more.
Thank you.
We're going to take a short break, but when we return, Dr. Gadea will join us to talk more about preventing different illnesses during the winter months and staying healthy during this time of year. So please join us.
I think one of the exciting campaigns that the VA Maryland healthcare system has embarked on is the TeleVet campaign. As a veteran myself, I'm really more interested in what a fellow veteran's perspective on their healthcare service is going to be. So I would really encourage all of our veterans who have been to a VA Maryland healthcare facility to tell fellow veterans about their experience.
I wish someone would have told me about the VA healthcare years ago. If you see a veteran, ask them if they're using VA healthcare.
Make a difference. Tell a vet. The VA Maryland healthcare system has 3 main campuses where we deliver medical care.
And also 6 outpatient clinics, which are conveniently located around central and eastern Maryland.
All these facilities provide a broad array of services: primary care, comprehensive mental health care services, audiology services, optometry services, podiatry services.
And at our main medical centers, we have a full array of medical services to offer all veterans.
Come visit us at any one of our locations. We look forward to serving you.
Welcome back to Veterans HealthWatch. Today's episode is all about getting and staying healthy. Joining us is Dr. Gadea. Dr. Gadea, thank you for staying with us. We want to turn our focus more specifically onto our veterans. And some of our veterans enrolled with the VA Maryland healthcare system have a patient-aligned team care, or a patient-aligned care team, I should say.
Yes.
So tell us more about that team, that PACT, and what does it stand for?
Thank you. PACT teams, which stands for Patient Aligned Care Teams, just like you said, are a vehicle for us to deliver patient-centered, comprehensive, team-based primary care to our patients. These PACT teams include a physician, a nurse care manager, a clinical associate, and an administrative associate, all working together to meet a veteran's needs.
And we want to talk about preventative care. And we hear that term used all around, especially nowadays, preventative care. How does the PAC team help with preventative care, and what exactly does it mean?
Well, I think we've all heard the adage that an apple a day keeps a doctor away, and there is some truth there. Making healthy choices can help us prevent the onset of certain ailments. Getting our shots when indicated, like we talked about the flu shot earlier, or getting recommended cancer screenings can make a difference and help us nip things in the bud. We have to individualize our recommendations on preventive treatments, and we do that through our PAC teams to make sure that our recommendations to each individual are based on that person's history, their family history, their lifestyle choices, their gender, and their genetics to help them get the healthiest outcomes we can for them.
And you mentioned screenings earlier. What types of screenings should people get, and when do they get those screenings?
Well, we have screenings that, again, are indicated for folks at various points in their life. For our younger female veterans, I think everyone's heard of pap smears, but our older female veterans do need to get mammograms. I think everyone would benefit from screening for diabetes and blood pressure, and some of our older patients benefit from targeted cancer screenings. But these decisions should be made after a discussion with a primary care physician to find out what screening is indicated and what screening is best for you.
And again, some of those screenings are based on your age, maybe other risk factors.
Absolutely.
Health risk factors.
That's right.
Great. And these are great things. The screenings are great things to remember, particularly if you've made a New Year's resolution to stay healthy or to be healthy. And what about scheduling those appointments? I understand that veterans can now, there's an app to schedule appointments, and which appointments can we use those apps for?
There's an app for that.
Exactly.
So veterans can now schedule their appointments online through downloading an app from the App Store called the Veteran Appointment Request Tool, and download it to their smartphone and go ahead and request an appointment. But we welcome requests for appointments through our other methods too. You can simply call your primary care team, send an email to your primary care team through My Healthy Vet, or
call the appointment center.
Or, yeah, absolutely. That's
center.
absolutely right. You call our telephone appointment line.
Great, great. But I love that. There's an app for that now for our veterans. We're getting there. For those veterans who haven't registered with My Healthy Vet, the online system to kind of manage your health, please tell us more about that site.
Well, our veterans tell us that they found it very helpful to them. It helps veterans see their lab test results, share them with doctors in the community. It helps them review their office notes. It also helps them send these secure messages to their team when you want to get the message across to your physician or your nurse, and it's important but not necessarily urgent, like a medication refill. And a great way is just to send it at a time of your convenience and send that message through, and we'll get it and we'll respond in a timely fashion.
And we have a local My Healthy Vet person here. If you have questions, you can call that person if you're having trouble.
Absolutely. We do have our My Healthy Vet coordinator.
So what about the, you mentioned doctors in the community. So some of our veterans use the VA Maryland healthcare system, and they still see doctors outside of that healthcare system. How can these two systems connect? How can these doctors communicate?
Well, the VA recognizes that and has developed a new VLER, which stands for Virtual Lifetime Electronic Record System. And this allows us to connect our docs, where the doctor in the community can see what's being done at the VA and review all of my notes and what I've done for my patients, and again help them make sure that the care is coordinated and safe.
Yeah, that exactly safe, so the doctors can see what the patient has going on at any point in time in the community or in the VA. And when we talk about appointments here at the VA, we talk about primary care appointments. I know at one time the VA Maryland healthcare system wasn't doing too great as far as the time it took to schedule a primary care appointment, but we've made some changes. We've turned things around.
Very true.
Congratulations. Tell us more about that.
Thank you. No, we unfortunately, we did have some of the worst wait times in the country, but we have turned that ship around, and we now have some of the best access in the country for our veterans needing care. We also have other ways to seek care through telephone appointments, and we're excited to be soon rolling out video appointments for our patients.
Video. looking forward to that. We might have to have you back on
over your smartphone
when that rolls out. And one final question. I understand that the Fort Howard Clinic closed back in 2016, and you've been working since then to find a new location for the patients who use that clinic and others. When will that clinic open? Tell us more about that project.
Well, we are excited to announce that a contract has just been signed for our new clinic that'll be based in Rosedale. This will take the place of our Fort Howard Clinic and also help veterans that are living in the area. So we'll keep you posted with the details as they come available, but we expect for an exciting year ahead as we get that clinic up and running, and stay tuned.
And what types of general services can veterans expect to get at that clinic?
We expect to deliver comprehensive primary care with the PAC teams in place. We'll also have mental health services that are available and all of these health screenings and flu shots there too.
Great. And could you tell us why, I wanted to go back to the preventative care aspect, and we hear so many things. If you watch TV, there's a pill for this and there's a pill for that. But what would you say as a clinician anyone should do to get healthy, stay healthy, maintain a healthy lifestyle?
Well, an ounce of prevention is worth more than a pound of cure. And so making these healthier choices, whether it's engaging in regular aerobic exercise, whether it's making healthy dietary choices, whether it's stopping smoking if you're smoking, avoiding secondhand smoke, and engaging in healthy behaviors will help prevent a whole lot of issues and really help one maintain their health into their golden years.
Yeah, so no magic bullet there.
Not yet.
Eat healthy, exercise.
Right.
And we hear so much about vitamins. What do you think we hear vitamin C, vitamin D. What's your clinical opinion there?
So recent evidence has shown us that there isn't really a role for multivitamins in folks that are healthy and eating a healthy, balanced diet. There may still be a role for vitamins in folks that are battling certain conditions or that have undergone certain surgeries, but I think the role for a general multivitamin for everyone is probably overstated.
Dr. Gadea, thank you so much for joining us and for reminding us about the basics. Eat a healthy diet, a healthy lifestyle, plenty of exercise and rest, and taking good care of ourselves.
Thank you for having me on the show, Kenya.
We're going to take a short break, but when we return, we'll continue our discussion about maintaining a healthy lifestyle and how the VA Maryland healthcare system can help you do that in 2018. Please join us.
It's important to get a new flu shot every year. It's very easy to do, and it can protect you or a loved one from getting sick. People who are at high risk for the flu are those who are over age 50 or those who have underlying heart or lung conditions.
The flu vaccine is offered free of charge. We do the vaccination in various clinics.
You don't need an appointment. You can walk in and get a flu shot when you show up. Thousands of people die from this, and it's preventable by a simple vaccine.
Welcome back to Veterans HealthWatch. New Year's resolutions frequently relate to health, losing weight, kicking bad habits. And here to join us today to talk about how the VA Maryland healthcare system can help with those resolutions is Kevin Grotniski, a MOVE coordinator and registered dietitian for the VA Maryland healthcare system. Kevin, thank you so much for joining us.
Thanks, Kenya. Glad to be here.
Well, thanks for joining us again. You visit us every year around this time to help us get on the straight and narrow. So tell us more about the MOVE program for those who aren't familiar with it.
So the MOVE program's the National VA Weight Loss Program. It includes, it's a 16-week weight loss program, although it can go longer, because our research shows that patients who stay in a weight loss program for at least a year tend to lose the most weight. It includes information about what to eat for health and for weight loss, physical activity, education, as well as on-site exercise at some of our locations, and behavior change coaching. Because many people, we can tell them what to eat, but they need tips and tools to help them make those changes and lose weight and keep it off.
And I've talked to veterans over the years who've participated in the MOVE program, and it's always amazing how much the veterans appreciate what they learn about nutrition and what they realize they didn't know, and all the bad habits they picked up over the years. So how effective would you say this program has been for veterans?
So veterans who stay in the program for at least a year, 71% lose some weight, 1% of their total body weight or more. How many lose at least 5% of their weight? about 30%. So 1 out of 3 will lose about 5% or more. And why 5%? 5% is considered clinically meaningful, meaning it may have a slight drop in the blood pressure or cholesterol. So now some patients have lost more, certainly. I'm thinking of one patient on hand, he's lost 100 pounds. Energy's improved, his health is improved. That's not typical for all of our patients, so it really varies per patient, but we've seen dramatic weight loss, we've seen moderate weight loss. It's really run the gamut, but if a patient is committed and focused, we hopefully can provide the tools and support to help them achieve their goals.
And most of those veterans come into a clinic or a medical center for the 16 weeks?
So so you have two main versions of Move that we offer here at the VA Maryland Healthcare Systems. You have our live Move program, and it's offered at the Baltimore Annex, Loch Raven, Perry Point, Glen Burnie, and Cambridge. And those are live programs in a group setting with other veterans. You have to be enrolled in the VA Maryland Healthcare System to participate in the Move program. We also have what's called a telemove program, and that's for patients who, for some reason, either they can't make it to our live classes or due to work or school or other commitments. So that's another really good option for patients. And if veterans want to do both, that can be an option. There are some eligibility requirements for the telemove program. So if they check with their primary care provider, they can learn more to see if they're eligible for that.
And I understand there's an app for that now.
There
for
is.
Move.
Yeah, there is.
Tell us about the app.
It's called Move Coach Mobile, and you can track your food, you can track your exercise. There are 11 lessons that you can receive education about nutrition, fitness, or behavior modification on the app. You can set goals, you can enter your weight, you can track your weight. So it's a nice app. Yeah. Right now it's just available for iPhones, but what I'm hearing from the national team is that Android phones should have that out in 2018. So this year. So hopefully we'll have it for both types of major phones.
So you can take Move on the go.
On the move, so to speak.
Right,
yeah,
on the
absolutely.
move. So what would your advice be to veterans for staying healthy during the cold winter months? That's been our focus today.
Okay.
And we know we tend to hibernate and overeat during that time. So what can we do to stay healthier?
Well, I think from the hibernation, I think if we think of physical fitness as 12 months a year, right? Okay. Many of us think, oh, I'm active when it's sunny and when it's nice, maybe spring, summer, and fall, but in the winter I tend to stay in, and it's pretty normal to do that. But if the mindset changes like, hey, I need to be physically active 12 months a year, how am I going to do that? So options like at the VA here for the Move program, we have gym access for Move patients at both Baltimore, the Annex, as well as Loch Raven Outpatient Clinic or the Loch Raven Medical Center. So those are options as well. If a patient is at Perry Point, you don't need to be in Move. If you get a consult from your primary care doctor, you could also, there's a gym there at Perry Point as well. So those are 3 options here on site. Certainly there are, basically if it's cold, how are you going to exercise indoors? Yeah. We have at move.va.gov, there are about 130 to 140 handouts on nutrition, physical activity, and behavior change. There are workouts for at home online that either whether you're a veteran or not a veteran, anyone can access, whether you're in Move or not. So va.move.gov, in the physical activity handouts, there are at home workouts. Right. Mall walking, at-home videos, YMCA, senior centers, there's lots of options. Yeah.
But I think the biggest point you made was just changing your mindset to realize I need to stay active 12 months a year.
I agree.
How can I do that?
And doing it indoors, winter, spring, summer, and fall, whether it's hot, super cold, raining, how do you exercise indoors? You've got to find some avenues for that. And
then with the winter months comes the holiday parties, or just like we said, staying inside. You're bored, or you're indoors a lot. How can we make better eating choices or better diet choices?
Right. I think for most of us, we're going to eat a little extra during the holidays. And I think it goes back to mindset again. If we eat a little extra at a Thanksgiving meal or a holiday meal, next meal or snack, you get right back on track. One meal that's a little higher in calorie won't make or break our general health, right? Okay. If that one meal turns into, hey, I've blown it today, I'll start Monday, or I'll start next week or next year, that's when trouble happens. If I had a couple, if I ate, my wife made some pumpkin pie and an apple crisp for Thanksgiving. I had some, I enjoyed it. Next meal for breakfast, I get right back on track. So the mindset is we can all enjoy a fun meal now and again. you get right back on track. Shouldn't hurt you.
Get right back on track.
Yeah.
Okay. And what about, I understand your team does free cooking demonstrations for our veterans. Could you tell us more about that?
Yes, so at Baltimore, at the Annex, we have a cooking demo, a healthy cooking demo every month. It's the third Friday of every month at 1:30 at the VA Annex. Right now it's just for move patients because there's a limit in space. We're hoping, and it's also at Perry Point once a month as well. We don't have a dedicated date yet on that, but it's our goal is every month to have the Perry Point cooking demo as well.
And I know we're working with you to get that on our Facebook page, so our followers can look out for some demonstrations on Facebook.
I think we're having a Facebook Live shortly.
Okay, great.
Yeah.
And then for the move, it sounds like the move is taking that whole health approach that the VA Maryland healthcare system is going toward. Can you tell us more about how that encompasses whole health?
Yeah, I mean, I think the idea that there's three pillars of health, so to speak, or three pillars in our MOVE program. You've got the nutrition piece, right? You are what you eat, and I think that can't be more true. Eat healthy, your cells and your body is going to be healthier. And then you've got the fitness piece. We provide education about what type of exercises to do, how often, how much, how frequently, and we also offer on-site exercise. And then there's the behavior piece as well. So I think we fit nicely into that whole health, that kind of holistic approach. The behavior, the fitness, and the nutrition, kind of a holistic approach to wellness.
And so how can the people, our veterans and those who love our veterans, learn more about the MOVE program?
Sure. So you can always call me. I'm the MOVE coordinator for the VA Maryland Healthcare System. It's 410-637-1245. And I'd be happy to answer any questions. If you want to learn more about at your particular site, the MOVE program, you can check with your primary care or allied health team, and they probably know when the MOVE program is. You can also call the call center and often make an appointment for the MOVE program through the call center as well.
Well, Kevin, thank you so much for joining
My
us.
pleasure.
We always enjoy having you here to remind us of those basic things we need to do to stay healthy.
Sure, my pleasure.
We're just about out of time, but before we end, I'd like to remind our viewers about the Perry Point Veterans Museum at the Grist Mill. This new museum opened on Veterans Day and has hundreds of years of history about Perry Point and the healthcare services we provide to our veterans. So please join us online or call us to learn more about the museum. And I also like to say hello to a new friend I made at the museum, Miss Lucille. Miss Lucille is a member of a veteran service organization. Hi, Miss Lucille. And thanks to all of our veteran service organizations for all you do for our veterans. And if you would like to learn more about the VA Maryland healthcare system, about today's show, or if you'd like to make suggestions for future topics, please give us a call or visit our website. And remember, if you are a veteran or you know a veteran who is not enrolled in the VA Maryland healthcare system, please visit our website, stop by one of our facilities, or call us. We love to serve you. Please join us next time.
There are numerous benefits for a veteran to enroll in the VA Maryland healthcare system. Number one, they get excellent health care. There's a great pharmaceutical service. They have specialists in all of the areas and use cutting-edge technology. And we have a very good electronic medical health record.
You can keep your current provider as well as come to the VA.
For our veterans, no matter whether they live in Central Maryland or Eastern Maryland, our clinics are conveniently located to where they live throughout Baltimore and the Eastern Shore.
The fact that there are other veterans here that I can talk to and share common experiences with.
The amount of medical attention that I received has been excellent.
The VA Maryland healthcare system is your VA. It's America's VA. It's the veterans' VA.
Since I've enrolled at the VA, it has been a great decision, and I encourage every veteran to enroll. They will not regret it.